Ladies and gentlemen, welcome to this afternoon session, course number 2 of the Hydration for Health Academy. My name is Jürgen König, and my only task today is actually to introduce you to this afternoon's program and to introduce the speakers. The question is, why do we need a session on water and fluid intake? And as it is always the case with and I need to start the presentation. As it is always the case with risk assessment, we have two pillars of risk assessment. One pillar is to identify the hazard, but I'm sorry to say that, and the other important pillar, I was tempted to say the most important pillar, the other pillar is also to assess the exposure to these possible hazards. And this is exactly what we are talking about this afternoon. That's why we need to assess fluid and water intake. So we need to identify the risk associated to the hazard and the exposure. So what are the risks associated with a low fluid intake? It's of course dehydration. We heard that in the morning. I think that's quite straightforward. Everyone knows that. So we need to assess exposure to identify low intake, of course, and to identify dehydration. So fluid intake is important, as you all know. But we also have other factors which may be a risk carried by water and fluids. For example, we need to check energy coming from sweetened beverages or things like that. We also have another risk which deals with microorganisms, with contaminants. Again, we need to have an idea about the exposure for these different agents, otherwise we are unable to identify the exposure and finally to conduct a full risk assessment. So this is actually what this session is about. What we also need, not for risk assessment, but also need to identify the proper amount of fluid intake we should have each day. And as you can see here, we have two organizations here. One is the National Institutes of Medicine in the United States, who are responsible to issue the recommendations for the North American population, to be very correct. And they are using actually to derive the acceptable intake for water from the exposure assessment. They do not call it exposure assessment, but it's total water intake from United States survey data. And the same does the European Food Safety Authority in their attempt to identify the proper amount of fluid intake. As you can see here below, these are the dietary reference values for water. And again, they are based on observed intake of fluids in water. So this is why we need proper instruments and need to understand how to assess water and fluid intake. So this outlines a bit the session of this afternoon. I just was trying to identify the risks and to set the DRV, the dietary reference values for water. So this is what we are talking about this afternoon. A brief introduction to our speakers. Dr. Jürgen König, is going to start with the principal methods of how to assess water intake data. Then we have Professor Hernando Martinez from Mexico, and he is going to talk a bit about fluid intake across different continents and present data on that. And then we have Dr. Maria Luga, who is going to talk about the other components, whether the fluid type actually matters. Is it only about water? Do we need to talk about beverages and things like that? And then finally, we have Dr. Isabel Gillings, one of our hosts today, and she's going to talk about how to create a hydrogenic environment. So you know what is coming up to you. We plan to have 20 minutes of talks, and we take questions after all 4 talks. We have 4 talks in the afternoon, so we have a very tight schedule. So I would like to encourage you, either use the app. I hope you have all the login credentials, so you can post your questions via the app, and we're going to screen them after the sessions. And you, of course, can also ask questions directly from the audience. We are happy to take them at the end of the session. As I said, we have a tight schedule, so I would suggest that we start already.